So we start the All-on-4 with IV sedation and then give the patient local anesthesia. From the standpoint of the procedure, what we start with is removal of all the teeth, top and bottom. So once that's done, we clean the area, irrigate, make sure there's no infection left, and move on to the next step. Probably one of the most important steps is when we actually do bone reduction. So what we're doing is we're taking all the irregularities of the bone that was left from as a byproduct of the disease process and the bone loss, and we're flattening out the bone so that we have a nice level surface. Not only that, we're actually reducing the bone height so that we have always a minimum of about 6 millimeters, so that we have enough room for the prosthesis and the implant and everything to fit together without making the structure too thin and susceptible to breakage. And it also helps a lot with the cosmetic aspect, especially with patients who have a pre-existing gummy smile or large, excessive vertical display of their maxilla. We use the upper teeth that were pre-made ahead of time as a guide. So we place that up on the palate. It actually kind of looks like a removable denture, but it's been modified. So we place that just to see the orientation of the front teeth. And then we begin to place our implants. The implants are placed minimum of 4 implants for the upper arch, 4 implants on the lower arch. The posterior implants, because of the sinuses and to avoid having to do sinus grafting and worried about nerves on the bottom and so forth, the posterior implants are slightly angled. Could be 17 degrees, could be about 30 degrees. And that allows us to have the connection point of the prosthesis as far back as we need it, but without interfering with critical structures like nerves and sinuses. Once a minimum of 8 implants are placed, and we actually connect what we call multi-unit abutments. These are the connectors that connect the implants to the actual prostheses. So these actual abutments have different angles, so that if we had to place an implant in a certain direction and it wasn't straight up and down, this abutment can actually correct that angulation. And then impressions are taken. The lab technician is here on site, and he will take those impressions and create a 3-dimensional model right on the spot. Those models will actually have analogs or replicas of the implants that we actually placed in their exact configuration, rotation-wise, as well as depth of placement. So he actually starts to process the teeth that were made ahead of time onto these 3D models. So all this time, the patient's basically just relaxing in the OR and just very, very comfortable. And that takes maybe an hour and a half to process. So by the end of the afternoon, the patient will have these teeth secured with tiny little screws onto the implants, upper and lower, and will be able to leave with teeth that are fixed and functional.